Yet another Wellness Wednesday. Welcome to June. Welcome to Youth Month. Welcome to Pride Month. Welcome to Ask Your Doctors. I'm your host, Dr. K. With me is our regular co-host, Dr. Bunolo Mashishi. Doc, how are you?
Hi, how are you?
I'm all right, thanks.
I'm good, thank you.
Welcome back.
It's good to be back.
Need I say it's a bit chilly?
It's quite breezy, hey? Just took us by storm, literally.
No, it's been building up. With the rains that we've been having, it was always going to be cold.
Yeah, given.
Yeah. Okay. Today we would like to understand a bit more about strokes and brain hemorrhage. And with us is renowned neurologist Dr. Dimakatso Makwela. Doc, how are you?
Well, thanks, and how are you?
We're almost related, right?
How are you? I wasn't that way.
Yeah, half my ancestors are in Limpopo.
Okay.
I believe you come from Limpopo.
I am, yes. I grew up in Mankoing, flew up in Limpopo.
Oh, okay. And you ended up in Joburg.
I ended up in Joburg to become a neurologist, yes.
Oh, awesome. Thanks for joining us.
Thank you for having me.
Thanks for making the time. Tell us, why neurology?
I found neurology a fascinating subject as a medical student. I studied at the University of the Free State. And in the clinical years, in the latter part of training, just before finishing off, you do clinical medicine, rotating in the hospitals, meeting the doctors, meeting the patients. The neurologists were always the kinder ones. To the patients, to the students, never impatient with us who needed to learn. And obviously, yes, with the fascination around the subject of neurosciences, the brain, the function of the brain, its connections to the body, and how all of that I found very fascinating. And obviously people, yes, made it even more interesting and intriguing, and that's what attracted me to the subject.
Oh, would you believe that, Doc?
No, that's quite inspirational, actually, the fact that you mentioned neurologists are the kindest and, the sweeter ones to patients and to student doctors. Yeah.
Is there a reason?
I suppose if you look at medicine as a whole, certain personalities will gravitate towards certain specialities.
Okay.
So in our practice as neurologists, you cannot rush the examination, the history taking. So unlike in surgery where things have to be done in seconds, with us, when you rush it, you miss it, and you put your foot in it. So the diseases, and most of the diseases, especially when you look into the subject of neurodegenerative disorders, they come slowly. And to understand them, you need to also take your time. Sit down with the person, take your time, learn about them. You may sometimes not even make a diagnosis at first encounter and have to repeat the encounters to try and work out the problem. So the personalities of those people who are calmer will take their time with the thing, unlike compared to someone like who is more into like trauma surgery and emergency care where things have to happen very quickly. So it's about personalities, I suppose.
And speaking of surgery, so neurology, we try and educate the public out there, and now that you've told us a little bit about your journey, hopefully that will inspire some young ones to maybe show interest in some of the subjects we're talking about. Neurology and neurosurgery, how do they differ, just for the benefit of the public?
So a neurologist practices and deals with neuromedical conditions, so conditions that will not necessarily need an operation to treat. Okay, so there's many inflammatory conditions on the brain, or spinal cord or nerves, infections like meningitis, neurodegenerative disorders, dementias, even epilepsy. So there's a whole lot of spectrum of diseases that may disturb the function of the brain and the body that will be require medication to treat and not surgery. The neurosurgeons are mostly into things that will need an operation, either as a result of trauma or tumors that need to be operated on, and that is where most of the difference is. There are certain things that will require surgery over medication, and then with the neuromedical side, we only deal with neuromedical conditions.
Okay. Yeah. Just out of interest, this question is not in any way in our prepared questions or the ones from the social media either. Do you guys necessarily get a lot more involved with medical legal stuff than many other practices?
I wouldn't say that be finding that to be true, all of the practices are involved in medical. So we are involved, as are even surgeons. I know that orthopedic surgeons do a lot of it as well. So yeah.
I just happen to have known one neurologist who was heavily involved in medical legal stuff.
There's a lot more than that.
In any case, guys, according to the Stroke and Heart and Stroke Foundation, 10 people suffer from a stroke every hour. I know stats are not always on the mark, but is that fairly accurate?
It is, yes. Strokes are very common, and very common with urban type of lifestyle. So they occur more frequently than we know, actually. Some people who have strokes, they may not be aware of it. And a natural history and progression of a stroke is that a stroke will happen and naturally get better, depending on the size and how big it was. So it is possible that there are people in the general population that have had strokes, have never been diagnosed, didn't even know themselves that they did have a stroke. So yes, they're very common, yeah.
And what about your job excites you?
All of it. I love my job. I love seeing people who need help, may have failed finding help with a lot of physicians and doctors, and then working out the problem that it's neurology can be problems that are difficult to work out, and finding an answer as to what's wrong. We may not necessarily find a cure most of the times, but we give you an answer as to what's wrong, what can you expect for the future and your future generations and your families.
Did you see how her face just glowed?
Yes,
when she said yes.
She
What do you enjoy more? She smiles so much. Yes, so that's great.
I love my
and
job.
you can't fake it, Doc. You do love your job. Doc, you're here. Guys, you are in luck. There's a virologist in the house, clinical virologist, Dr. Mashishi, and our guest, who's a neurologist, Dr. Dimakatso Makwela. Now, how the two come together is you are in luck because I'm going to pick their brains, no pun intended with the neurologist, regarding how long COVID affects us. And both of them agree that there's a lot of neurological symptoms that we come about in the long COVID. So stay tuned because Dr. Bunolo Mashishi, when she goes viral, she will tell you about long COVID.
While we're speaking about strokes, like we'll get to long COVID, but in the interest of what we're discussing now, maybe just to explain to someone out there, what is a stroke? You said someone might experience a stroke and not necessarily know they have it. So what is a stroke?
So the name stroke just refers to a disturbance in blood supply to parts of the brain, and the brain cells will be, because of hypoxia, will die. And the symptoms are vast. Symptoms depend on where and which part of the brain is affected. So it's simple enough to know that a person who has weakness on one side of the body with face drooping, people know that to be symptomatic of what a stroke could be. But where it does not affect parts of the brain that govern that movement, then it gets a bit tricky, and that's why I say there are people who've had strokes and they don't know. Where it affects parts of the brain that subserve coordination and balance. So the symptom could just be a loss of balance, or an eye that loses vision, or both eyes losing vision, double vision. It can be that subtle, depending on exactly where it is, and that's why people may not recognize it. But we do advocate that people know about the mnemonic, be fast, and what each letter in that sentence stands for.
Yes,
the B for balance. When you lose balance or feeling like you have poor coordination, get help. The E for eyes, your eye losing vision on one side, both eyes, or even just double vision. F for a face that's drooping. Sometimes people don't even see it, and someone who's looking can tell you your face is pulling to the one side. And the A as being for the ataxia. Okay? Ataxia, that means loss of balance as well, or coordination. The S is for speech, slurring in speech, difficulty speaking. Okay? And then the T just says that you've got time, be aware of your time, present to your local emergency care facility within 4.5 hours, because something can be done to reverse a stroke within 4.5 hours. And this can be done, it's going to be done in a hospital facility, not at the local primary healthcare clinic or a primary healthcare doctor's clinic, but it needs to be in the hospital because you need a scan to first confirm, and then you can get some help with the stroke.
I actually like that mnemonic, because it kind of covers the spectrum of how strokes present. I think, many people may have an idea of what or how a stroke should present. They may have seen it, but they only gravitate towards a specific type, and that's usually, my arm is weak, or, loss of, I can't walk anymore. So I love that mnemonic because it really covers the spectrum of symptoms one can potentially expect from experiencing a stroke. But generally, how do we group the types of stroke for somebody who may not know?
So strokes are grouped as ischemic or hemorrhagic. Ischemic essentially just means there's a plug or clot within your blood vessel system, and that clot prevents blood flowing into a specific part of the body or the brain, and that part will get what's called ischemia. It just means that it does not receive its oxygen, and it does not, it dies from a lack of blood supply. The hemorrhagic ones, it's where you have bleeding. Hemorrhage means bleeding, and that happens where there is a rupture in a blood vessel. So the rupture itself disturbs blood going to a certain part, and also because there's now a clot, the clot becomes a space-occupying lesion. It increases pressure within the brain, and the brain suffers as a result. So the differences are that, yes, we need that CT scan now to know which one you have before you can get your acute treatment that can potentially reverse a stroke. That treatment would apply more to the ischemic ones. There is IV medication that can be given. You dissolve the clot, you restore the blood flow. Within 4.5 hours, you expect that that brain tissue hasn't suffered permanent damage, and the function therefore can be restored. However, if it's a hemorrhagic or bleeding stroke, we do not give anything to dissolve because now we need a clot. And giving the medication to a person with a bleed is going to worsen their situation. You're dissolving the clot that's keeping the blood from flowing even further, and that situation can lead to a worse outcome and even death for that person. Hence, I say a person needs to be in a hospital setting. You need a CT scan before this kind of medication can be given, and it cannot be done without there having been a CT scan first to exclude that there's no bleeding in the brain. Yes.
Before you go on, Doc, where it's bleeding and you need the clot, how did you say we resolve that?
So there's not a whole lot that's done for acute treatment in a hemorrhagic type of stroke.
But importantly, though, you don't make it worse by giving blood thinners.
No, you do not give blood thinners, and especially not in the acute setting. Much later on, after 2 weeks, you can review your situation and give other medication that you would not necessarily have given in the beginning or early on. But yes, so it has to be seen that it's not bleeding, therefore we can intervene within that 4.5 hours.
Yeah. So you've mentioned how, people need to present within 4.5 hours, and some people refer to that as like the golden time or the golden hour, the opportunity to make a difference in somebody's life. So what are the chances of recovering? I know you mentioned, the treatment options, if it's ischemic versus hemorrhagic, but what are the key points that someone needs to know? Is it reversible? Can they recover? What are the time frames? And yeah.
Okay. So recovery of a stroke obviously is based on those, first of all, that classification, which one is it? And the general state of health of a person is important. So a person who, I'll mention like diabetics, hypertensives, those conditions, unless you check, you may have gone unnoticed. And the longer you have it, the more your brain suffers. It may not show with weakness as in a stroke, but there's strokes that happen, they're called microvascular, where they're very tiny strokes. The brain gets affected because the diseases damage the very tiny blood vessels in the brain. And you may have all of these tiny strokes scattered everywhere. So when a large stroke happens, the recovery then is going to be slower in a person like that. The brain already has damage from other things. Okay, so also importantly, the intervention that you receive at the beginning is important. A person who receives this kind of treatment in an emergency setting like I'm talking about, their chances are higher than someone who does not receive that kind of care. So a person who has other problems or other things that they do to their body, alcohol, smoking, and all of those kind of things. So the healthier your brain was to start with, the higher your chances of recovery. And also even general health, exercise, muscles, and how healthier your whole body is will determine eventually how the outcome is. If there was already poor health to begin with, the heart itself not working so well, or the muscles, and in a sedentary type of lifestyle where there's generally poor health, that person, obviously, their recovery isn't the same as someone who starts off in a better position. Yes.
I take it also, Doc, the more comorbidities you have, the more complications you have with pre-existing conditions, the more difficult it is to even give you some kinds of medications.
Yes, yes, that's true.
So the healthier you are, the bigger the scope of medication that can be administered.
And the recovery time, the
Yeah.
recovery time changes.
Recovery will change based on general health, fitness, and all of those things. And also, the other thing is mental health and motivation. The more motivated people are to recover, they do better. Because we need a lot of, we can need a lot of intensive rehabilitation. We involve the care of a physiotherapist, occupational therapist, speech therapist, including psychologists. And people who have bigger motivation do well when it comes to rehabilitation. If you're not even motivated to want to attend those things, it usually doesn't go.
A simple thing like eating and taking fluids when you are getting dehydrated. I had an incident with my daughter where she refused to do anything. And I wasn't there initially, but by the time I got to her to try and force her to eat, because she had an episode of, I think it was vomiting, and she got dehydrated to the extent where she was now losing her mind.
Yes, that's true. So food and hydration is also very important, that's true. First of all, if you would find that even a simple thing like you're saying, not even just taking enough, can literally make your day feel like you're depressed, and it becomes a difficult day. So the nutrition is important, and healthy nutrition at that. Not a lot of sugary things that give you a big high and then you
slump.
Yeah, you slump.
Yeah.
So like healthy type of things that will contain food from all groups of nutrition. Things with a longish glycemic index, and then you're full and you have energy and vitality for a full day. That helps also with the recovery in case of a stroke. Yes.
No, that's all very interesting. Thank you for that. You know, we forget sometimes to look at the brain, that it's an organ on its own. It's a significant part of the body. You know, people are very well versed when it comes to a heart attack. So I always think of a stroke as, you know, heart attack of the brain, and it's urgent, and people shouldn't take it lightly. And, you know, you get some people who perhaps stay at home, not seeking care, just because they think, no, it's mild. I just felt floppy, and it's not that situation. But when we go into greater detail about what is going on in the brain when one experiences a stroke, how do we explain that to our patients when we're trying to explain the gravity of the situation, but to help them understand how the brain is actually being affected? We mentioned poor oxygen and blood flow, but what else should they be aware of?
So I'm happy you mentioned the thing about a heart attack, because it is essentially the same thing. So you have ischemia in the heart. The reason why people will seek help there quickly is because it's painful. So the brain knows how to interpret pain from other regions of the body and things around the brain itself, but it does not know how to feel pain when it is itself is affected.
That's an interesting one.
The brain does not have pain receptors at all. Any headaches that you feel is because of the blood vessels in the brain or the meninges, the cover of the brain. The brain itself, no brain receptors.
Or the sinuses.
The sinuses, or other things, teeth, the neck and neck joints, eyes. So when you feel pain, it is not in the brain. The brain interprets pain coming from elsewhere. When the brain tissue itself suffers, then it's painless. And that is the reason why people will sit They just see an arm that's weak or drifting, and they don't realize there's actually a big problem happening. But the pathophysiology or the physiology behind it is exactly the same as what's happening when you have a heart attack. There is lack of oxygen, then your cells go into oxidative stress, releases bad chemicals there, but you don't feel it because it does not cause pain, and you'd only see the results on the body. So yes, people do need to know this is as important. Okay, if you lose your brain and you lose your brain function, then the body does not function. So it is very important that you seek help immediately when things like that happen.
Before we go to our social media questions, Doc, there's something I need to mention that we were taught about in the 90s when I was at varsity, that it's critical that you mention the speed at which we approach the hospitals. Can you believe that there are times where in our society, people will still always go to the traditional doctor first? And there's a queue there, and no, I'm telling you, it's true. They will still go there, and then they will try that, and then the amount of time wasted, I don't need to mention what it will cost us. But in any case, let's go to our social media questions, and one of them says, can a high heart rate cause a stroke? You know, when you go to the gym, I want my heart rate to go high because I want to get those points on my watch, from my watch reporting to my medical aid that I was in the gym. That is good, isn't it? For the heart rate to go up now and then.
Yes, the heart rate is good to go up and then. I mean, that helps you burn calories. That's what the body tells you. But up to a certain point. I mean, a normal healthy person would not have problems with heart going up 100, 120 in the gym. But if there is conditions...
160?
That's bad. Okay. Up to a point where it can be classified as V-type or ventricular tachycardia. The heart now does not give enough time to fill its chambers, so when it's contracting, it gives blood flow to the brain. So if in that situation, I mean, your body will tell you this is overdoing it because you start feeling lightheaded. Okay, so that says that things have been overdone now.
But if you're in the gym, you are feeling it.
Well, if you're feeling okay, that's fine. The issue is when there are symptoms related to that. So even a normal heart rate, or let me not call it normal because that's already too fast, 120, some person will be okay and another person is, for them, that's too much, depending on what your usual resting heart rate is.
Is caffeine and energy drinks dangerous to an extent that in high doses that they can elevate the heart rate so much that you...
Yes.
Let's get past that one before we go to social media.
So caffeine can be bad, yes, if people are overdoing it. And there's a lot of people drinking energy drinks. They are, people need to check what you're drinking. If you look at the can and the amount of caffeine that you're taking, it's extremely too high. And that is, taking it regularly is bad and damaging for the heart. Blood pressure is forever elevated. The heart rate that's forever elevated. That can lead into heart failure itself. And heart failures then come with its own sort of problems and complications here. So overdoing it is bad.
While you're speaking heart rate, what is the range? A good range?
So a resting heart rate, you will find that it's said to be around 60 to 80 beats per minute. But a healthier, more gym type person, they have a slower resting pulse rate. It can be even down to 40, which is why I say, what is your normal? So you'll find a person who's usually going at 80 beats per minute, when they get down to 40, their brain starts suffering, and there's dizziness and there's all kinds of problems, but that range is good.
It's something, Doc, and when I'm sitting at home, how can I check my heart rate?
Count every beat per minute, sorry. Start counting,
is there a
look
cheap
at the
device
watch.
I can buy that I can keep at home?
Well, I cannot recommend any.
A watch. A watch.
Yes.
If
you put your
watch is 3,000. What about the blood pressure monitors? If I buy a decent one.
Well, I don't know if also that blood pressure monitor, you need to know how to use it. Yeah. Okay. The simple way to know is to put your hand on the pulse, count per minute. That's the
A good
simplest way.
old-fashioned watch, just a round
And
watch.
what do you count there?
You're counting every beat that you're feeling on the wrist.
Not press too hard, not too light.
No, pressing up to a point where you feel it. I know people will try and think, I want to feel for a pulse there, but on the neck, that's
Okay.
a region I'll stay away from. But on the wrist, that's easy enough. It doesn't cause problems.
Okay, that's one of our social media questions, the one about heart rate and stroke. You've covered most of our social media questions. So someone says my left-hand side went completely numb. Is this a sign of a stroke? This is a
Yes,
typical
maybe.
question you would
Yes,
get.
that numbness, that's concerning and that needs to be checked out, yes.
Okay, other signs and symptoms of a stroke? That's another question. And what should people be on the lookout for?
So like I was saying, with that pneumonic be first. Arm weakness, face pulling to one side, double vision, blindness, balance issues, speech, and now you suddenly don't even understand what people are saying, and yet they speak in the same language that you speak.
It sounds very, very valuable. Guys out there, please go to your internet and look for the BFAST mnemonic as it relates to strokes. It tells all. It sounds like a very useful tool to always refer to.
Yes, it is, because not all strokes will present with arm and leg weakness, and people know the arm and leg weakness as the stroke, but there are more subtle ones.
Because it's visible outside.
Yeah, because it's visible and it's easy to tell this is a stroke, but the subtle ones are more where there's difficulty in knowing, yes.
Smoking is always the devil. How does smoking make us more susceptible to strokes?
By damaging blood vessels. So smoking causes atherosclerotic disease and accelerated atherosclerotic disease. So the more unhealthy your blood vessels are, the easier that you'll get into these situations where there's clotting in there. Also, blood pressure relations with the smoking as well. Blood pressure is also a reason to damage your blood vessels, and that causes a link into strokes as well.
Okay. I know in our case that we cannot do implants for you if you're a smoker, because the blood supply to the implant is not enough to, and when people exaggerate it, they say, I don't know if that's true, every time you're pulling on a cigarette, there's seconds when your blood doesn't get oxygen in a certain area.
Of course, yes, that's true. Because you're replacing your usual atmospheric gas, which contains this much oxygen, with what is in the cigarette now.
Okay. There's also a question about Habli and vaping in comparison to smoking. I think we made an editorial agreement that we don't want to handle that because the research on that is very light these days. So we're not going to handle vaping and Habli, but at least we understand how smoking affects our blood vessels and eventually leads to stroke. Family history of heart disease, how does that relate to strokes and heart disease, the family history?
So the heart is important, a good healthy heart is important for good brain function, because the brain requires a heart that pumps well to supply it with oxygen, to supply it with nutrients, glucose that it requires. If your heart is not doing its job, the brain is going to suffer. So if there are inherited problems, yes, they can lead into problems that can eventually lead into a stroke. So a heart fails, for example, or there are problems with the valves, then if they're not closing and opening between the chambers of the heart, they easily make clots in there. The clots end up with forming strokes. If there are problems with conduction and conduction defects, or where the electricity of the heart is disturbed, that can be possibly inherited issues where your heart suddenly makes very fast beats, then goes slower, so it does not have a nice rhythm to it. That's a conduction issue. With those kind of things where it's not conducting easily, you end up with clots forming inside the heart. The clots then eventually migrate when the blood is pumped out and end up causing strokes. There are other ones where there is holes between the chambers where they shouldn't be. Those can also cause clots, and the clots end up causing stroke. And the other important inherited issue would be one of cholesterol, familial hypercholesterolemia. So your body does not know how to metabolize cholesterol easily because of a problem on the genes, and they can easily make clots within the blood vessels and in the heart, in the brain as well.
So simply put, the heart has to be healthy for you to be less predisposed to strokes,
yes,
whether it's familial or not.
exactly.
And just, can I add here, I like this conversation maybe on hereditary conditions, because it also highlights the importance of age. You know, everybody thinks stroke affects old people, and we forget that when you're young, you can also get a stroke. And I think maybe just to remind our young audience there that you're not too young to have a stroke, yeah.
Yes, definitely. Strokes can happen in the or in a newborn, all the way up to the very elderly. So obviously it's more common in an older population, but no one is exempt from it. Sicknesses that result in blood being easily clotting or bleeding. So any of the, like anything under the sun really can predispose even a newborn to a stroke.
Can I tell you why guys in their 20s and 30s would probably be more predisposed to these things? They eat a lot of meat, chisa nyama. They smoke all kinds of things, including herbs and whatever. And they drink a lot of energy drinks
There we go.
on top of alcohol.
Yes, the lifestyle is important. So this weekend Chisanyama business, that is dangerous.
And that happens to be our next question, and you did answer it before, our next social media questions regarding lifestyle, to say even your chances of healing are better.
Exactly.
But when we speak of healing, apparently brain cells, neurons, are the most difficult to heal in the body. Can you tell us a little bit about that?
Yes, brain cells once lost, you cannot regenerate them.
Okay.
So, like I said earlier, your chances of recovery is in finding that they are still alive. Once they're dead, they're dead. And if you don't, like, you know how they keep saying, if you don't use them, you lose them. That's exactly true. So they do not regenerate where they have been lost. They cannot regenerate, especially in an older individual. There's a thing about what's called neuroplasticity, which talks about how regenerative brain can be and all of that. That's a thing that works better in a younger individual, like in children and all of that. And it's seen where a person may have had like traumatic injuries to the spinal cord maybe, or even brain. They recover better because of that plasticity itself. They can, they can rewire a sort of a thing. So injuries and the recovery can be different from what a clot and ischemic injury can be. Like where you have a traumatic injury, the recovery can be different because what's still left there can still reconnect elsewhere.
Yeah.
However, if the cell itself is dead, that you can't come back from.
Doc says there's a saying, if you lose it, you don't use it, you lose it. I thought that was derogatory when people say, you must use your head, man.
No, actually, that's very true. It's very true.
And unfortunately, when you speak of plasticity, neuroplasticity, strokes are known to occur in older people where chances of recovery are much less because, you know, ability to regenerate is diminished somehow.
That's true.
Yeah. So diet, can you give us light at the end of the tunnel to say, okay, if you live like this is good for you. You said exercise, right?
Yeah, exercise.
Eating right?
In moderation also that exercise and everything in moderation. The problem is overdoing things. If you think of a person who likes meat is the thing people, we like it. It's very addictive. But when you're overdoing even meat daily, at every meal there's meat, think of the fat content, the cholesterol in there, how it's been prepared, that's bad. Okay, so if you stick to a diet where you're taking in mostly fresh veggies and fruits, it is possible to take in fresh vegetables, in salads, in smoothies even. You get all the nutrients that is still there. It's not killed off by cooking or overcooking, that kind of thing. So that is your best chance of recovery there. If it is difficult to eat cauliflower raw, try putting it in a smoothie and you get all of its nutrients. You know what I mean? So
don't go extreme, Doc. raw cauliflower is 10 times worse than cauliflower.
So put it in a smoothie mixed with fruits.
Yeah,
the taste becomes different, but you get all of its nutrients.
Or at least say they must steam cook it and eat it.
That's great.
Okay.
Just don't overcook it, then you kill all of its nutrients.
We must crawl before we start jumping into
Steam
these
it,
healthy foods.
Grill it. That's great.
Okay.
But be careful of how much oil you put then when you, and dressings. People will say they have a salad that's healthy, but they overdo the dressing, and now you've brought in the cholesterol and fat.
Luckily, I don't do dressing.
Yeah.
Doc, I want you to ask that one.
So how do we supercharge our brains? We've spoken about caffeine and overdoing it, energy drinks. That's always like our go-to supplement when we're trying to super energize. But what are the better ways?
The best way is exactly what I'm talking about. And it has to be a lifestyle process. You cannot do it once. It has to be a daily progressive thing. Exercise is good. Exercise strengthens your heart, brings more blood flow nicely to the brain. Eating as well, the food that we eat.
Doc, I have an answer to that one. The brain consumes only two things, right?
Yeah.
Glucose and oxygen.
Yes.
That's how you supercharge your brain.
Exactly.
But you can't like directly infuse.
The glucose.
No. People always say, no, I drink juices and that's...
But again, we have a problem with what kind of juice, how much of it. Like I was saying, everything in moderation. If you go for 100% juice, that's also too sugary. What does the sugar lead to? Obesity and fat, diabetes, then you have a problem.
I was about to say, breathe properly, meaning exercise.
And stop smoking.
And
stop
vaping.
Vaping.
Yes,
Stop
because then you are not inhaling oxygen. That's number one. That's also that oxygen is sorted. Then number two, keep a normal blood sugar level.
So exercise. How does that oxygen now reach the brain? A healthy heart. So exercise, make your heart stronger, control blood pressure, okay, and get them checked. You are not going to know that you have a high blood pressure unless you check. Okay, so people sit for years and years, and then you're surprised you have a stroke, and you do not want to discover you have high blood pressure on the day of a stroke, or you have a heart attack or something like that.
So high blood pressure monitor is like your cell phone. You just need to be taught how to use it properly.
You just need to be taught, exactly. Yes, you can go first to the clinic. You don't even need to see a doctor to do it. See the nurse practitioner. They monitor your blood pressure there. If you have a monitor as well, know how to use it. You can ask them, am I using it the right way? Get to jot down those measurements. So when you visit the doctor or the nurse in a while, you show them your measurements and they can say, well, this is good, or this is, we need to change this and that. That's the best way to do it. Also, getting the sugar and cholesterol checked. People, you need to be checked. Okay, if not once a year, but I mean, if not more than once a year, at least once a year.
General checkups.
Exactly.
Just
do the blood test. Yeah, you will not know what your cholesterol is without having done a blood test. Okay?
And let's not ignore family history, because if you know in your family there is a history of strokes, high blood pressure, diabetes, that puts you at a higher risk, so you should be even more energetic and eager to go check. Yeah.
Eager to go check. And while we're on the subject, people would say that the diseases run in my family, high blood pressure, diabetes. And the question is then to ask, are they hereditary? The answer is no, they're not hereditary. You're all eating the same problem. You're all doing the same, you live the same lifestyle. And then you say it's in my family.
I've got two analogies. One would say, in my family we have bad teeth. It starts with my mom and then it's me. I say, someone between the two of you and your mom started buying the sweets and it continues to the kids.
Exactly.
It's not hereditary.
It's not hereditary at all.
And the other one is, I always tell people when they say something runs in the family, I said, if you're born in a certain socioeconomic situation, we're born in villages, quarter camps, what, you always make sure you work your way out of there. You can't say, I was born in this socioeconomic situation and I'm going to die because of it. You always work your way out of there and you end up where you end up.
So we can use the same analogy when it comes to health. The family is obese, get yourself out of there. Okay, because people eat the same, they live the same, and then they'll think it's a family thing. Everybody just has high blood pressure. If that's not hereditary, it's not infectious, change your life and then you'll see. Change what you eat, exercise and all of that, and things get better.
There's an unfortunate incident that happened to Bruce Willis recently, and I hope he's recovering. I mean, sometimes we are so detached when we speak about celebrities as if they are not human beings. And let's hope he's doing better. And can you tell us what's in the media? You cannot, it's still speculative at the moment because not all the facts are out, and they shouldn't be because it is private health, you know. Yeah. Can you tell us basically what the argument is about?
So the issue was that it was reported that he's got aphasia. And what is aphasia?
Yes.
We were discussing about aphasia being a difficulty in understanding language. It can be broken down into many different parts of it. People who had an injury or a stroke affecting language center, what is called language centers in the brain. The area is usually on your dominant hemisphere. So if you're a right-handed person, your dominant hemisphere is on the left. So there's an area around there called Wernicke's and Broca's where we interpret language. And any damage there, either from a stroke or tumor or even some dementing processes, can result in this symptom or sign called aphasia, where now it's either you do not understand the language anymore, it sounds foreign, yet it's your own language, or you cannot speak it or write it anymore. So that's essentially what was reported, aphasia. But what they're not saying is what's causing it. It can come from a stroke, yes, but it can be even just destruction of that same region, either by a tumor or dementing process or that kind of thing. Yes.
I would accept the fact that it's still speculative so far. And is the recovery from aphasia, or it depends on the
It depends.
on
it
the
depends.
causes?
Yes, on the causes. I've seen people with a stroke recover,
Okay.
or people live with it. I mean, when you have global aphasia where you don't understand anything anymore, that will be like being in a dark hole now. You don't know what people are saying to you anymore. So it must be a very scary place to be in. But yes, people come sometimes with strokes and they do recover.
Doc, while Dr. Bunolo is preparing her long COVID talk and explanations, and maybe she will interrogate you further about what she's going to ask, I think, let me give it to you. You are very articulate in explaining, and I'm sure you are the kind of neurologist that would make one want to do neurology.
Yeah, definitely.
Yeah.
She has the
I mean, you're
personality
calm,
for us, yes.
and you are very technical yet understandable, and I enjoy this. I'm enjoying this.
Thank you, I appreciate it.
No, I'm enjoying this. You keep up, and stay in academia. I'm sure you will produce a lot of good academics and practitioners in general. Doc, it's over to you.
Yeah, so I really echo your sentiments. I think you're right, it's a personality thing, you know. I imagine you're so patient with your patients. Neurology can be quite scary for the patients because they don't really understand. And the brain is not something that you see physically. To have someone explain it and break it down, that is wonderful. And
as calmly as she does.
Yes, beautiful to see, yes. So maybe just to take a step a little bit out of strokes and talking about long COVID. It's something that, I don't know, maybe people haven't heard about or they haven't experienced. Long COVID refers to some of the symptoms one experiences after the initial week of COVID, where you have the cough and, you know, the fever and all of that subsides. And then you have a couple of months where you just don't feel right. You know, some people are tired, some people are forgetful, they've got memory loss, their hearts, maybe they've got shortness of breath. So it affects multiple organ systems. I don't know how common you're seeing long COVID from your clinics, or, you know, neurologically, how much of it are you seeing?
So we are seeing patients who, because of COVID, had neurological manifestations which recovery from may be difficult. They are, COVID can affect the brain. As we know, it can cause strokes. So now you deal with the effects of the stroke.
Yeah.
You can also have things that are called, that are inflammatory in nature, in the brain itself or in the spinal cord. And then there's loss of function because of that, or even in the nerves. COVID can be associated with a disease called Guillain-Barré syndrome, where the nerves lose their cover and sheath, and therefore they cannot conduct normal electricity like they would, and the person is weak because of that.
Yeah.
So mostly what we're seeing in our practice is more effects out of those conditions versus the fatigue and all of that. So I assume they'll be seen by more the general practitioners, and there are people who have even psychological, long-term psychological.
Yeah.
You can imagine a situation of a person who came near death in ICU and all of that, and the trauma, the mental health trauma. So we're not really in neurology, or in my practice at least, seeing a whole lot of more of the non-physical symptoms where a person may just not be feeling right and they're not sure what's going on, but rather more what happens to the neurological system as a direct result of COVID itself. So people are left with long-term weakness and in wheelchair bound because of weakness, because of the nerve issues or the spinal cord inflammation that may have happened secondary to COVID itself.
Yeah. And that's quite important, because I often get asked, what is the issue with long COVID? How does it come about? And one of the difficulties is really differentiating the acute systemic effects of COVID that result directly from the virus, or the after effects of the virus. And there's a lot of studies and there's a lot of research going on about long COVID, but certainly it's multifactorial. A lot of things influence it. Age, pre-existing comorbidities. Diabetics have been at a higher risk for developing long COVID. The unvaccinated population groups, how severe your initial presentation was. So you mentioned like how people maybe had Guillain-Barré in the initial episode. So obviously you are more likely to develop long COVID because you are not going to recover as quickly as someone who just had a cough, for instance. So it's multifactorial, and when you speak about inflammation, there is that aspect that a viral infection, and not just COVID, can trigger an inflammatory response, almost like autoimmunity, and that can also push people into experiencing long COVID as well. And it becomes very difficult when you have so many things impacting on the clinical presentation from a treatment perspective, obviously. And so we really do advocate, and the message still goes out there, that the best way really to prevent long COVID is to vaccinate. Yeah.
I was about to ask that one.
Yeah. So yeah, that.
Are you happy with your presentation?
I hope people understand the impact of COVID. It's not just
long
now.
COVID.
It's long COVID. Yes. Yeah.
But the effects can be lessened by pre-existing conditions. And probably vaccination.
Vaccination, yeah.
That's true.
Yeah.
And also, the people must stop this myth of saying, I want to get the real thing. If I get the real thing, I get sick, then I'm fine.
Then I'm fine.
Yeah, but that's the problem. You don't know that you'll be fine.
You don't know how fine you will be.
You don't know if you'll be one who ends up dead from the real thing.
And who develops long COVID.
Or develops long COVID.
Yeah.
That's true.
Yeah.
So Doc, give us light at the end of the tunnel. Let's say we are in a normal family setup and someone is recovering from stroke. What are the little things you can do to help them out?
Motivate them.
And feed them,
eh? Feed them the right things.
Yeah, I suppose,
Okay, the right things. And also let it be a learning opportunity for everyone. What are the things that led to that situation? How can we prevent it? It's best to prevent than try to cure it. Because the issue is, like we're saying, even with COVID, you don't know which spectrum you'll be in. Will you be the one to get the mild one or the very severe ones? So it's best to try and prevent. And stroke is is the most preventable condition
Yes.
out there. So prevent it and don't want to find out, do not want to find out how you will be with the stroke, yes.
Pointers on prevention, just in short.
Get yourself checked, okay?
Okay.
Being a gym is good, but don't overdo it. There are people, and this is something I wanted to mention earlier when we were talking about gym, wanting to build muscle using steroids. That's a risk for stroke, okay? So that actually, I found people with big muscles and other muscles are paralyzed. You can't use them anymore because of a stroke. So the normal, healthy way of doing things.
Smoking, alcohol.
Stop smoking if you can, or at least cut it down. With every reduction, you get a health benefit. Alcohol in moderation, and yes, get yourself checked. Do your regular yearly check at least. Get the cholesterol checked, the sugar checked, the blood pressure, and that's it.
Need I say to you guys out there, regular oral health checkups also help to prevent atherosclerosis.
Yes.
Because we get bacterial deposits into the blood vessels that actually lead to blood vessels getting diseased themselves. So it's a well-known thing that you need to check your teeth regularly. You see, I'm also important.
Very much so.
Yeah, Doc, how do people get in touch with you if they want to ask some of these questions? Are you available on social media?
I am available, yes, on Twitter, Instagram, and Facebook. They just need to go look for Dimakatso Makwela, MD.
Oh, Dimakatso Makwela, MD.
Yeah,
Okay.
I found the other Dimakatso Makwelas there.
Oh, okay.
Yeah, with the MD at the end, but you'll find me, yes.
Okay, that's fine. And Doc?
It's been a pleasure, I think.
Okay.
Yeah, I think with me, my socials, everybody can find me on social media as well. I don't have a practice, but on social media, Instagram, that's my main
Practice.
platform. And it's Dr_Mashish.
Okay. Guys, this is for you to be able to ask some pertinent questions out there. You can't do consultations either on this program, on our website, or on any one of the doctor's pages. But it is just ask intriguing questions. If you read about something and you think the doctor might find time to entertain your debate, do it in a good way, don't troll. And you may also find all our specialists on our website, which is www.askyourdoctors.co.za. I'm usually bad at these things, but today I got it right. And if you do want to get in touch with our specialists that have been here before, go to the menu and click on the tab that says Find a Doctor. Sometimes you may even want to make appointments with some of the guys that have been here before. If you want to advertise on our platforms because you think our brands align, you can also go to the email address that's on the screen here, or go to our website, or just drop us a DM. And it's also been a pleasure, Doc. I hope you will not be a stranger. No. Guys, thank you, Doc. Until next time, keep asking your doctors.